And I just want to start by saying that on behalf of Regents Hospital, we are really sorry and saddened that this event happened. We are taking a lot of steps and actions right now to understand how this did happen, and I think as we understand what might have happened, we will share that with you. But I just have to share that we are really looking into things right now and are very saddened by this.
So what do you know happened?
The remains of a 22-week stillborn baby were inadvertently included in linen that we sent down to the Red Wing linen facility that we use. It was found by employees at Red Wing, and they notified us of that fact.
Chris, what would be the proper procedure that would have been followed in a case like this of a stillborn in how it goes to the morgue, and how is it normally handled?
Yeah. So when there's a case of a stillborn, we work very closely with the family to understand how they would like to handle the remains of the baby. Sometimes they ask us to take care of that, and other times they take care of that. The remains are secured in the morgue, which is located here at Regents in a secure area of the hospital.
Have you notified the family?
We are reaching out to them today.
But you haven't notified them yet?
We're working on reaching out to them.
When is it that the hospital realized the remains were gone? Was it when Red Wing contacted you, or did you realize before then?
Correct, when Red Wing.
Can we get some perspective of how rare this is? How many stillborn occur in a day or a week or a month? Give us some perspective of how unusual this is.
Sure. So at Regents, we do over about 2,500 or more births a year, and the unfortunate circumstance of about 20 to 25 stillborn babies in a year. So it's relatively rare, maybe two a month. This has never happened before that I am aware of, this unfortunate event. And again, we are just very saddened by it and really digging in to try to understand what happened.
Are any employees being questioned about it or held disciplined in any way?
I can't really comment on that, but just know that we are talking to all involved staff that might have been involved with any of this. So we're working with our staff.
What day would those linens have been left here?
I am not certain on the date of that. I'm not certain if we send linen every day or if that's every couple days. So I can't answer that.
The linen service comes to Regents to pick up a couple times a day.
A couple times a day?
Yeah.
So if this baby was stillborn on the 4th, which is almost 2 weeks ago, I'm trying to understand, would it have been sitting in the morgue up until a couple days ago?
Yes, that's correct.
That's normal, something like that?
Yeah.
Okay.
This baby was stillborn on the 4th?
That's what I believe is accurate.
You know, that again, that's information that you might have from other sources like Red Wing Police, I believe, but that's information that we can't, as a hospital, confirm because it's protected health information.
But I guess what I'm wondering,
Yeah.
it's not unusual to have the remains like this sit for a week and a half or so.
It's not unusual. Correct.
What would be unusual, though, is that you lost track of it. And
Again, we are investigating and trying to understand what happened with this case. Yeah, it was a very unfortunate, sad case, yes.
What's the hardest part in investigating what happened for you folks?
Oh, I think just, as with any investigation, just understanding the sequence of events and again, just taking a very deep dive and understanding.
is the normal process somebody from this facility comes to the morgue, collects the linens, and then leaves? Or what is the transition? I mean, how many people would come in contact potentially with the linens?
And again, I think those are the type of details that we're trying to understand with the investigation. I'm unable to answer the details of how those processes work, but those are the sort of things that we'll be looking at.
You said sometimes it's the family that determines the disposition, or they choose to have the hospital do it. What would the hospital do with the remains?
We work with someone in the community to take care of the remains.
So cremation would do it.
That would, yeah.
Can you say what the family had indicated its wishes were?
Again, I need to respect the privacy of the family, so those are things that I need to keep that confidential and just know that I can't answer that.
So you're not saying whether even the family's been notified yet?
We're working on notifying them this morning.
Working on, so they haven't been yet?
Yes.
Is the family from the Twin Cities?
I can't answer that. Again, I need to maintain the privacy per the federal privacy laws. I really do need to do that.
And you're offering counseling, I understand, to the folks at the linen company? For those who, I think I read something about that?
Was that in the
Yeah, that's right.
release?
We offered our support to the linen service, to the employees there, and also to our own staff too, because obviously, this hits close to home for those of us that work in healthcare. So our chaplain service is available.
Yeah. We understand the emotion that can go with that, and so we're providing that support.
Is anybody with the laundry taking you up on the offer?
I'm not aware of I'm not sure.
We reached out to their folks. Our CEO contacted them, and I haven't heard whether or not they're taking us up.
Can you talk about now what happens when there is a stillborn? Is there a birth certificate issued or a death certificate or more like that?
We follow all the state statutes and laws with that, but I can't really speak. I don't know the exact details of that to be able to speak to that.
Where is
Tell
it?
this is an emotional thing for you.
Yeah,
This is
yeah.
to describe that, what you're feeling, having to deal with a situation that's this delicate.
Yeah, I didn't get much sleep last night. I think, as with any caregiver, which I'm a nurse, and everyone that works here, that's our number one concern is our patients, our family. So we're very troubled. We're deeply saddened and troubled that this happened, and want to make sure that it never happens again.
Tears over this, is this that kind of emotion?
Sorry.
Tears over this, and is it that kind of emotion?
Oh yeah.
I don't know if you can explain a little bit more about the process of, so where in the location would laundry people in the morgue take the sheets from, or kind of where the baby could have been, where it was collected?
Again, those are part of what we're trying to understand. We have a very clear process and policy on where we place deceased and stillborns and other patients that have expired here. So we have a very clear policy, and again, they are secured and stored in the morgue.
So if there's a clear process and policy, clearly something went wrong.
Yeah.
Will someone lose their jobs?
Oh, I wouldn't jump to that. We need to investigate. There's still things we don't know that we have to figure out. So we need to do our due diligence, really understand.
Maybe one more question?
But it's not unusual for a stillborn to be in the morgue for that period of time, and why would that be?
I think, as we said before, that's not uncommon.
Awaiting.
Again, we work
I know
closely.
it's delicate to
Yeah,
say,
I know.
But I guess trying to understand, okay, what is the period of time here that, trying to make arrangements. I guess.
Again, we work closely with the family, and there are some cases where the family asks us to take care of the disposition of the remains. So.
Thanks, everyone.
Okay, thank you.